Hello, friends. Today we have AI for the doer. W is for workflows. I'm Dr. Sonali Tamankar, and this is AI A to Z. Here is a familiar story. A man loses his keys and starts searching under a streetlight. Someone asks, "Did you drop something here?" He says, "No, I dropped my keys way over there, but there is more light here." This is known as the streetlight effect. We focus on convenient actions even when they don't solve the real problem. A lot of AI adoption today looks exactly like this. We have incredibly powerful AI tools, we have aggressive vendors, we have flashy demos, and so many organizations start searching for places to use AI, not starting with where the real problem is, but where the shiny light is. This is the classic hammer in search of a nail, a solution in search of a problem, which is exactly backwards. One of my favorite tips in AI solution design comes from a Penn State data scientist. Their idea was to have their business partners fill out a Madlib. Here is a simple example. As a commuter, when I'm stuck in traffic, if I knew a much faster route that was available, I would take it to improve my odds of avoiding road rage. Today's maps have live traffic data, and AI offers a solution to the task find a faster route. This is effective because the solution is embedded in our workflow. What if our phone battery was dead, or we left the phone at home, or the car phone mount was broken? Even perfect AI model fails if it isn't embedded in how the work actually gets done. Most AI systems today perform a task, but how this fits into the whole story shapes the impact of AI. I'll organize this episode around 6 ideas, which we will use as a map for this conversation. We just talked about the Madlib, how it helps with the streetlight effect, who is doing the work, what decisions are they trying to make, and what would actually change if they had better information. Such an approach helps align stakeholders, clarify problem statements, and define solution constraints before we invest time building AI models. It turns out this is critically important. The McKinsey State of AI report in 2025 found that redesigning workflows is a key success factor in AI implementation. The report found that many of the AI high performers are redesigning workflows to help transform their business. Meanwhile, the MIT report, the GenAI Divide State of AI in Business 2025, estimates a 95% failure rate for enterprise AI initiatives. A Forbes article emphasizes that to convert AI's potential into real business outcomes, organizations need more than incremental task efficiency. They need systemic reinvention. Leading organizations that successfully leverage AI tend to take a comprehensive, thoughtful approach with a keen awareness of implementation challenges. For this episode, I'll use examples from healthcare, though many of these patterns generalize to other domains. Dr. Girish Nadkarni, an expert physician scientist at Mount Sinai Health System, describes what he calls a leaky pipeline. In healthcare, there is a persistent gap between what gets researched and what gets implemented. Driven by misaligned assumptions and poorly framed problem statements, this is another flavor of the streetlight effect. AI solutions may get designed for the wrong patient population. Organizations may lack the necessary data infrastructure. Implementation software may be missing or cumbersome, and adoption may falter once the tools reach clinicians. I'll link a video below where Dr. Nadkarni walks through these challenges and outlines Mount Sinai's 5-step strategy. Identify tractable problems, develop the model, test the approach, monitor, and evaluate. By starting with the why, this framework enables the design of holistic AI solutions that can actually make a difference. It's easy to underestimate the breadth and depth of organizational investment required for successful AI, and when that happens, batons get dropped and impact evaporates. A classic paper I link below talks of hidden technical debt of machine learning systems. Ongoing integration, monitoring, feedback, and maintenance costs need to be budgeted for, but often get neglected. Workflow fit is necessary to avoid adoption friction, according to the MIT article. Organizational AI literacy and individual attitudes can also matter. A study involving over 6,000 radiologists found that the use of AI can be associated with higher burnout, especially among radiologists with high workload and those with low AI acceptance. Another study in Nature Medicine showed that the effects of AI assistance varied substantially across individual radiologists. The authors emphasized the importance of personalized human AI collaboration and found that inaccurate AI predictions could actually degrade clinician performance. Okay. So agentic AI is an interesting step towards task chaining, the idea of giving AI an overall goal and letting it plan the steps or deploy the agents to accomplish that goal. So the report, How AI Agents and Tech Will Transform Healthcare in 2026 from the Boston Consulting Group, makes the bold claim that AI co-pilots will transform clinical workflows, freeing clinicians from the administrative overload. I'm personally not sure about the freeing part, but their prediction that 2026 will be the agentic AI year is echoed by many others. Workflow integration with agentic AI can look very different. My personal thinking for the AI solution design is be like water and let your solutions take the shape dictated by the problem. This means starting with the problem and being open to different approaches, from simple rule-based AI to machine learning to GenAI to AI agents, and working closely with the business partners who will actually use the AI tools. This flexibility matters because in many enterprise settings, even the idea of a clean linear workflow is too simplistic. Recent work in process mining argues for thinking beyond workflows toward object centric systems where patients, clinicians, data, and resources interact in a complex, non-linear ways. Process models capture a comprehensive representation of reality through event records and health information systems. A review of 263 articles found that process redesign was only elaborated in 5.3% of the published process mining papers, highlighting just how often understanding fails to translate into action. AI usually doesn't fail because models aren't smart enough. More common failure modes are when we optimize for tasks instead of workflows, and workflows instead of systems. So we talked today about the 95% failure rate for enterprise AI due to dropped batons and the need to be flexible in finding solutions. In a fast-moving technological landscape, thoughtful investments in AI infrastructure, in AI literacy, and judicious but committed implementation may set the leaders apart from laggards. So tomorrow we have a tough letter, X. Worry not, we have a topic. XAI stands for Explainable AI, and we'll explain all about it tomorrow. See you then, and bye for now.